Congratulations and welcome to Lowell General Hospital. This is the hospital's main entrance. These main doors are open from 6 a.m. until 11 p.m. If you arrive after hours in labor, you will enter through the emergency department entrance. You do not need to register in the emergency department. Go directly to D5. It is a good idea to call your healthcare provider and let them know you are headed to the hospital. This is our patient service center, which is where you would come for any lab work or lactation outpatient clinic. Approximately 2,400 babies are born at Lowell General each year. Our providers include OBGYN, family practice, and midwives. If you have a specific birth plan you would like to follow, it is important to share that with your provider as soon as possible. You should also share it with your labor and delivery nurse once you are admitted. We will do our best to accommodate your wishes. This is the family lounge gathering area. It has restroom facilities for your family to use while they wait. The labor and delivery unit as well as the maternity MIU unit are secured units. Enter by pressing the button on the wall and announcing the reason for your visit, and then you will be buzzed in. Do not push on the door or the alarms will sound. In addition to the patient security measures, both units have door timers. Through these secured doors, we have our outpatient testing area. In addition to the outpatient testing room, we have 12 labor rooms, 4 antepartum rooms, 2 operating rooms, and a hydrotherapy room. Beyond these doors are our ORs. As the ORs are a sterile environment, surgical attire is required beyond this point. Our antepartum rooms are located to your right. These are the rooms you will stay in when you come into the unit for possible testing or to evaluate labor. You may have support people in your room after a discussion with your labor and delivery care team. And support people are welcome to use this additional waiting area. As we practice family-centered care, children are allowed on the labor and delivery unit, but must be accompanied by an adult who is responsible for them. This adult cannot be your support person. Remember, when you are packing, you do not need to bring the baby bag yet. It's best to have the car seat installed in your back seat ahead of time. Just bring the essentials that you will need while you are in labor. Feel free to bring music with you if you wish. We also have many comfort measure options such as birthing balls, a hydrotherapy tub, rocking chairs, showers, and warm and cool packs. We also have pain management therapies including nitrous oxide and epidurals. You can request any of these from your nurse. If there is anything else you would like, please ask your nurse. We will try our best to accommodate your wishes. Please let your healthcare provider team know which options you are interested in trying and if you have a birth plan. After the baby is born, we encourage skin-to-skin contact and rooming in. If you or your support person would like to cut the cord, please let your healthcare team know prior to the birth. Your baby will have 2 identification bands as well as the mother and the significant other with the baby's name, date, and time of birth, gender, and an ID number. A security device will be placed on your infant's ankle. This helps us track where your infant is at all times. If you take medications, please discuss with your provider whether or not you should take them. Down this hall, we have our hydrotherapy room as well as a few more labor rooms. The hydrotherapy room is for relaxation purposes only. You may bring a bathing suit if you are more comfortable. Through those double doors is the secure staff-only access area. That's where you and your baby along with your support person will be transported to the mother-infant unit. A few hours after the baby is born, you and the baby will be taken down the hallway or elevator to the mother and infant unit in a stretcher or a wheelchair. Your support person may want to bring in whatever items you wish to have with you during your stay on MIU, as well as your baby bag. MIU is another secured area. All visitors must use the intercom system for access. It is important to note that visitors must give the mother's last name in order to enter the unit. If you have a vaginal delivery, you will be on MIU for 2 days. For C-sections, you will be here for 3 to 4 days. If you would like to be discharged early, a home visit from a visiting nurse will be scheduled as long as the pediatrician and OB provider agree that you are ready for discharge. In addition to room service, refreshments are available in the Patient Refreshment Center. Please let the staff know if you need assistance. Your nurse will care for you and your baby in your room. The nurses plan their care so that you and your baby are not separated during your stay on the mother and infant unit. If your baby does go to the nursery for any reason, the baby and mother's bands will need to be matched when the baby returns to your room. The rooms on both the labor and delivery and mother and infant units have flat-screen TVs with Skylight. Skylight is a feature that allows you to watch educational videos and take surveys whenever you would like. Products from our gift shop can be ordered through Skylight and delivered right to your room. Skylight also allows you access to the internet. Feel free to bring your own laptop if you are interested in uploading pictures. There are pull-out beds on both the labor and delivery and mother and infant units for a support person to spend the night. Having your baby in with you is also strongly encouraged. Products from our gift shop, including breastfeeding supplies, can be ordered through our gift shop over Skylight. We have lactation consultants on staff 7 days a week. Our lactation consultants meet with all breastfeeding moms. If you have questions or concerns about breastfeeding after discharge, you can schedule an outpatient visit with our lactation staff. They also offer a warm line that you can call when you are at home for breastfeeding questions. We offer drop-in new mom support groups every Tuesday from 10 a.m. until 12 noon that is run by a lactation consultant. All moms and babies are welcome to join regardless of feeding preferences. The birth registrar will come to your room to do your infant's birth certificate and necessary paperwork. The worksheet will be given to you when you arrive on the unit. Mom 365 is our photography service. They are available should you choose newborn photos. Again, we do encourage family-centered care and encourage you to have your baby with you in your room. Our Level 2B Special Care Nursery is a 10-bed unit and can accommodate patients as young as 32 weeks gestation. This area has 3 parenting rooms for parents who are no longer patients to have a private space with their infants who are in the special care nursery. We are affiliated with Floating Hospital for Children at Tufts Medical Center in Boston and have neonatologist pediatric coverage 24 hours a day. Thank you for choosing Lowell General Hospital. We look forward to providing you with complete, connected care.